Hi everyone, my name is Ishi and I hope you're doing well. Today we'll be covering the effects of transcranial direct current stimulation, or TDCS for short, on schizophrenia. So what is schizophrenia? Firstly, it's a low prevalence mental illness that affects approximately 1 in 100 Australians. As mentioned in the DSM-5, it's also a spectrum disorder which defies specific classification, meaning there are varying levels of psychosis. The symptoms of schizophrenia can be categorized in negative, positive, and also cognitive. The negative symptoms are categorized by the absence of normal behaviors, such as emotional responsiveness, motivation, and a sense of self. And then we have people who experience positive symptoms, such as delusions, associations of unrelated ideas, and hallucinations, which are central to schizophrenia, and can either be auditory or visual. People who experience these symptoms also experience an excess or distortion of normal life. And lastly, we've got cognitive impairments, such as memory deficits, problem solving, lack of attention, and fluency, which are the most occurring symptoms for schizophrenic patients. These cognitive deficits, which impact one's learning and memory, can be associated with changes in the structure and functioning of a number of key brain systems, including the prefrontal and medial temporal lobe regions, which are involved in the working memory and declarative memory, respectively. The cause for schizophrenia unfortunately remain unknown, which is why I think it'd be interesting to explore the recent studies and effects of TDCS on schizophrenia. TDCS is often used as a non-pharmaceutical technique for medication resistance patients in schizophrenia. This form of neurostimulation uses constant low-intensity direct current of 1 to 2 milliamps, which are delivered by electrodes placed on one's head and is non-invasive. TDCS works by gently influencing the frequency of signals in one's brain via an anode, which is a positively charged, and cathode, which is negatively charged. This triggers the hyperpolarization in neurons and are helpful for schizophrenic patients by facilitating or inhibiting effects upon neural activity of either the overperforming or underperforming of areas of one's brain. TDCS in schizophrenia involves modulating the cortical excitability through the resting membrane potential, which is believed to alter the brain structure, resulting in neuroplasticity changes at the synaptic level, such as the activity of the receptors. Furthermore, this triggers an increased ionic permeability at the synaptic level, allowing for synaptic transmission sessions to vary in frequency and intensity. TDCS has been shown to have a relatively selective effect, leading to rapid betterment of auditory hallucinations in patients with schizophrenia. As mentioned by Agarwal et al. 2013, to further support the influence of TDCS in bettering the auditory hallucinations in schizophrenia, Herman et al. Had conducted the TDCS method on their patient's Wernicke's area using the unilateral cathodal stimulation. Their sessions lasted over the course of 10 days, where the patient received 5 minutes of TDCS daily. The key finding in Herman et al. Study correlates with Agarwal's statements in regard to prominent reduction in auditory hallucinations, as well as persistence improving at 6-week follow-up. Similarly, Brunel et al. 2012 suggests that undergoing TDCS for 20 minutes twice a day with an interval of 3 hours, 5 consecutive days, is effective in reducing auditory verbal hallucinations, as the efficacy appeared almost immediately after the TDCS sessions. Furthermore, in regard to Brunel et al. Study, placing the cathode electrode on the left temporoparietal region and the anode electrode on the left dorsolateral region can reduce the occurrence of auditory hallucinations in patients with schizophrenia, and they claim that this effect lasts for up to 3 months. As mentioned before, TDCS aims to manage the overperforming or underperforming areas of one's brain, and schizophrenic patients experiencing auditory hallucinations tend to have increased activity in the temporoparietal regions, as well as dysfunctions in the cortical regions. So with the use of TDCS, we can really decrease the activity in the temporoparietal regions to reduce any auditory hallucinations, as well as increase activity related to cognition by placing the electrode on one's cortical regions of the head. In contrast to the findings shown in Agarwal et al., Herman et al., and Brunel et al. Studies, Fitzgerald et al. In 2014 researched the effects of TDCS by comparing bimodal TDCS to sham stimulation. In one study, stimulation was provided unilaterally, whereas in the second study, it was provided bilaterally. As a result, either the unilateral or bilateral TDCS resulted in a substantial change in either hallucinations or negative symptoms, although it was observed that stimulation was well received and tolerated without any side effects. A key difference in Brunel et al. Studies and Fitzgerald et al. Studies lied in the amount of times they performed TDCS on their patients. While Brunel et al. Conducted TDCS twice a day and Fitzgerald et al. Conducted it once daily, perhaps this is why there was no substantial change found in the occurrence of hallucinations or negative symptoms of schizophrenia. Furthermore, the effectiveness of TDCS on schizophrenia can be influenced by factors such as medications patients might be taking, skull thickness, the state of the patient's brain before TDCS, as well as the positioning of the electrodes, which influence brain activity during hallucinations or number of sessions, and also the individual resistance to the treatment. Although TDCS has its benefits, such as being cost-effective, non-invasive, and effective in treating negative symptoms of schizophrenia, the most immediate issue that needs to be addressed is perhaps establishing the further support for the effectiveness of TDCS for positive symptoms through further large-scale systematic studies. In addition, the impact of TDCS on other symptom dimensions need to be evaluated. Equally important are also long-term studies to establish the safety of TDCS in schizophrenia. And contextually speaking, understanding the predictors of clinical responses, the specific symptoms that respond best to the intervention, and those that do not are very important and relevant clinical questions. The size of the effect and persistence of positive responses suggest that TDCS is altering a fundamental pathology in the diseased brain. Concurrent application of investigative TDCS to characterize the neurobiological aberrations in subjects with genetic risk for schizophrenia is another critical area for future research. Understanding this would be crucial from the pathophysiological point of view, since it can provide important leads towards identifying a reliable biomarker for schizophrenia, something that has eluded the research community for several years. This will have a far-reaching impact on the diagnosis and treatment of this chronic and often difficult to manage disease. Future work should focus on establishing the clinical efficacy of this technique and also on evaluating this modality as an addition to cognitive enhancement protocols. Understanding the mechanisms of TDCS as well as the determinants and neurobiological correlation of clinical responses to TDCS remains an important goal, which will help expand the clinical application of TDCS for the treatment of patients with schizophrenia. Thank you so much for listening. I hope you all have a great day.